Hello everyone! Today in this video I will be talking about 30 phrases we use when we go to the dentist office. For those of you who do not know, the dentist's office is where we go when we have any kind of problem with our teeth or our mouth. If we have any kind of mouth pain or teeth pain, anything happen within this area, that is where we go to get it fixed. Similarly to the doctor's office, it is very important to know how to communicate with the dentist as well. So if we have any kind of issue with our teeth, we need to be able to tell this to the dentist. So that is why learning these phrases is very, very important for you. Number 1, I have a dental appointment. So dentist, and appointment. This is when we call in and we talk to somebody over the phone to schedule a time where we can go in and see this dentist. Number 2, I need to see the dentist ASAP. So ASAP stands for as soon as possible. So if you have some kind of emergency in your teeth or in your mouth, we could say this: I need to see the dentist ASAP, right away. Number 3, I'm experiencing tooth pain. So keep in mind, in English, we use teeth for many, but if we're just talking about one, we say tooth instead. So tooth is the singular and teeth is the plural. So I'm experiencing tooth pain means that one singular tooth is hurting a lot in your mouth, and maybe you're not so sure as to why this is happening. Number 4, instead of saying tooth pain, we can also call this a toothache. So you can say, I have a toothache. And remember the pronunciation with this A-C-H-E. We pronounce it ache with a hard K, not the ch sound. Number 5, I broke a tooth. So broke is the past of break, right? To break something. This has happened to me before. If you have some kind of accident, or maybe you fall down on a very hard surface, you can actually break one of your teeth. Number 6, I have a cavity. A cavity is just a small hole in our tooth. So we get this if we eat too much sugar and we do not brush our teeth properly. It could happen from other causes as well, but mainly cavities are caused by eating unhealthy food and not brushing properly. Number 7, my gums are bleeding. Our gums are just the top or bottom of our teeth. This is the skin that we have around our teeth. They are called gums. So if your gums are bleeding when you brush your teeth, it means there is a more serious problem happening in your mouth that somebody has to fix. Number 8, I have sensitive teeth. Sensitive means that they can be in a lot of pain just by eating cold ice cream, or if you eat something really, really hot. Usually it's with cold items, but we can have a lot of pain in our mouth just from eating really cold or really hot items. If you do, it means you have sensitive teeth. Number 9, I need a dental cleaning. So the dental cleaning, this is the most basic thing that we can have done at the dentist's office. And this is just when they go around and clean your teeth in a professional manner, not just using a toothbrush. Number 10, I have bad breath. So this just means that when we breathe in or out, we have bad smell happening in our mouth. Again, this can happen for a few different reasons, but we should get it checked out with a dentist. Maybe we have some kind of food stuck back in our throat. 11, I need a filling. So this goes with the cavity. If you get a cavity, the hole in your tooth, it means you will need that filled. This is called the filling. So I need a filling. Number 12, I need a root canal. So this is a very painful procedure, and it's kind of like a mouth surgery that they do. So the root canal, this is when we have a tooth that has gone really, really bad, and basically needs to be taken out and have some other kind of surgical measures done to that area to make sure that it's okay. Number 13, I need a crown. So here we're not talking about the crown on our head like the king or queen. We are talking about a small little cap that goes over top our tooth. If you have a lot of problems with one specific tooth, then maybe you will decide to get this. Number 14, I need a tooth extraction. So extraction just means to take the tooth out of your mouth. So to pull it out is to extract the tooth. Again, some people have many different problems, but if you have one tooth that is causing you a lot of problems and money, maybe it's easier just to take it out. Number 15, I need braces. So braces are the wires you see people have on their teeth, and these wires are to help straighten the teeth. When I was younger, I had crazy teeth going on. So I've had braces for 2 years, and now you can see my teeth are very nice and straight because of them. Number 16, I have a loose tooth. So a loose tooth means that you can move it. So maybe it is almost ready to be taken out, or some problem has happened with it, so it needs to be removed or extracted. Number 17, I grind my teeth at night. So grinding your teeth is like this. We rub our bottom teeth and top teeth together. Some people do have this habit when they sleep. If you do, the dentist will often recommend wearing a mouth guard when you sleep so that it protects this from happening. Number 18, I need a dental x-ray. So the x-ray is the kind of machine they use to look inside of your teeth. So this is just to make sure everything is okay and to look and see if there are any problems they need to fix. Number 19, I need a mouth guard. So that's what I was talking about previously with the grinding of the teeth. There could be some other reasons too why we need to have a mouth guard when we go to sleep. Number 20, I need a teeth whitening. So teeth whitening is just to make your teeth look more white, for them to be bright like the movie stars. Number 21, I have a dental emergency. So an emergency, it needs to be fixed as quickly as it can be. So if we tell this to the dentist right away, I have an emergency, then maybe they will take you in and look at your teeth quicker than normal. Number 22, how long is the wait? How long will I have to wait before I can go in and get my mouth fixed? It depends where you go, I think. In these small dental offices, maybe it is not so long of a wait time, but if you go to one of the larger ones or more popular ones, then maybe you have to wait for some time. Number 23, can I schedule a cleaning? So this is just to make an appointment to get my teeth cleaned. 24, can I get a cleaning today? So this is when we are making an appointment over the phone, or maybe you just go into the dental office to see if they have any openings for the same day. Usually this does not happen. In my experience of living in Canada, definitely not. However, in some other countries, maybe this would be possible to do. Number 25, how much does the visit cost? This is always a good one to know before we go and get everything done. How much money will I have to pay for this visit? If you have the dental insurance, it's usually not very expensive. However, if you do not have this, it can be quite a lot of money. Number 26, do you accept my insurance? Very, very important to know whether your insurance will cover the cost or not. Number 27, is the dentist available now? So this is just asking if the dentist is in the office and if he or she is free. Number 28, can I speak to a dental hygienist? So the dental hygienist is the person one step below the dentist. So they will help with the cleaning and they will assist the dentist in everything that he's doing. Number 29, can you explain the procedure to me? So if you are sitting in the dentist chair and they are telling you what they will do, however, you are sitting there and you are super confused, you have no idea what is going on or what they're actually going to do, you can ask this, can you please explain the procedure again so that I can understand better? Number 30, can I book my next appointment in advance? So if you know you will be back at the same dentist office 4 months from now or a year from now, then maybe you can book this in advance so that you know you will have that slot scheduled in for exactly that time. Those are my top 30 phrases we can use when we go to the dentist's office. These are very important to know. I am aware it can be very confusing when you try to speak with a dentist or to understand what they are actually doing. Because the same like when you go to the doctor, the dentist can also speak very, very fast. They often do. So even as a native English speaker, I sometimes have to ask them to repeat what they are saying or what they mean in a more simplified way. So do not be afraid to ask them to repeat because they often will speak very, very quickly. Thank you so much for watching. Have a great day. Bye-bye.